yet, though we keep hoping that hopefully next year we will be back to our traditional way of holding this. As you know, each year since 1999, the League of Women Voters of Lawrence Douglas County has recognized a Kansas citizen for contributions to transparency in government. The award is given in honor of the late Helen Fluker, a longtime lead member who served twice as our president, and some of her family's here. So if you guys want to wave so everyone knows who you are. Thank you. Okay, Helen Naramore Fluker was born March 22nd, 1919. She had a long history of working in government abroad. And when she returned home, she continued her involvement in political and community affairs. In Lawrence, she became involved with a number of organizations and, of course, the League of Women Voters. She was a member of the local board of directors and of the League of Women Voters of Kansas as well. Her efforts were concentrated on recruiting new members, organizing finance drives, and mentoring new board members. Her primary interest was in promoting open and accessible government in Lawrence and Douglas County, and she insisted particularly, which is something that I think we all still struggle with maintaining nonpartisan policy. Helen's warmth and concern for the League of Women Voters was reflected in the commitment she inspired from its members. This award was established in her honor, and this year's award will be presented to Molly Wood. Molly will be introduced by Mitzi McFadrich. So Mitzi, why don't you go and take over?
Janice, thank you so much. And thank you all for letting me be here and talk about one of my favorite advocates in Kansas this morning. And that would be Molly Wood. I've had the pleasure of advocating alongside Molly for about 15 years. She is compassionate, she's funny, she's generous, she's intelligent, and one of my favorite attributes, she's full of courage. She has worked for decades to create better public policies that serve older adults who need long-term care at home and in care facilities, as well as those who need hospice services. And Molly is widely respected as one of the premier advocates on long-term care issues by government staff, by other nonprofit advocates, and by her fellow attorneys in Kansas. She trains, she writes, she advocates, all in order to assure that older Kansans and those who assist them have the information, the tools, and the expert assistance that they need to protect older adult interests. She generously volunteers as a trainer. She helps older adults successfully navigate the complexities of the Medicaid system. And if any of you have helped an older adult or advocated on behalf of yourself in the Medicaid system, you know how difficult that can be and how important the doors are to be open to those needed services that frail older adults often require. She trains on abuse and neglect issues. She trains on what the legal tools are for people to protect the interests of older adults, like powers of attorney and healthcare directives. For more than 25 years, Molly has written and spoken on the important and complex long-term care issues, making them readily understandable for people like you and me who are helping older adults. She writes regularly for the Douglas County Senior Center newsletter, as well as for KABC's newsletter. She volunteers on the boards of directors of many local nonprofits that serve older adult needs. And in 2018, Governor Kelly appointed her to a really important consumer advocacy position, overseeing and licensing of nursing home administrators, where she serves as a strong consumer advocate for those who need that kind of advocacy. But I have to say, in the nearly 15 years I've known Molly, Some of the most impressive advocacy I've ever seen her do was starting in 2011, when the state decided to move its Medicaid system to a whole new program. And instead of state agencies overseeing the Medicaid program for the 400,000 vulnerable children, people with disabilities, and older adults who use the Medicaid program in Kansas, they transferred the responsibility for providing those services to 3 for-profit managed care insurance companies. That was a radical departure from how the services and supports for vulnerable Kansans had been handled in Kansas for many, many decades. One of the first things that the then new administration of Governor Sam Brownback was, they took this step of closing SRS offices around the state of Kansas. That might not sound like a very important thing, but if you are low income, if you're a person with disabilities, if you're an older adult and you need access to the Medicaid program and the services and supports that it provides, being able to access that in your local community, not having to drive to Kansas City or Topeka or Dodge City or someplace far away, is really important. Having one person who manages your application and responds to the questions that you have is really important. And with the closing of those SRS offices, what we were afraid of was that the governor was really trying to cut off access for people to those really key and important services, to keep them at home, to keep them functional, to keep them with healthcare, and to keep them connected to their communities. And as it turns out, that's exactly what was happening. Even though it was touted as a cost-saving measure, in fact, what it was doing was narrowing the doorway or closing it altogether to keep people who needed those Medicaid services, those safety net programs, from being able to access them. The governor's office bullied lots of advocates to try to keep them quiet. As a matter of fact, they sent to the board of directors of Kansas Advocates for Better Care, where I was then the director, a letter basically telling them that I wasn't acting in good faith and encouraging them to get rid of me as the executive director. They did that to other nonprofit advocacy organizations. So in the early days of this big change, there wasn't a lot of advocacy able to stand up and say, this isn't right. Molly stood up. She walked to the very front of the room. She wrote an amazing piece for the newspaper that was published in newspapers all across Kansas that was called The Big Lie. And in The Big Lie, Molly said some things to alert the public to the dangers of what was happening. One of the things that she said was that Governor Brownback's administration is trying to sell us the notion that restricting access to basic life-sustaining programs is in fact sound public policy. The SRS, excuse me, I got lost. These SRS office closures produce little savings in terms of dollars compared to the value of the services they provide to our friends and neighbors. Those who bear the brunt of this cure-all are blameless and very poor. Are we to believe that there are too many Kansans who are unworthy of consideration and support? Logic tells us this is not a panacea to balancing the budget. It was a shot heard around the state of Kansas, and it was often referred to again and again in the years going forward as the Medicaid program began to crumble and the doors of access closed further and further. With every new act by the administration to restrict the rights of older adults from accessing the Medicaid safety net programs, Molly stepped up. She stood ready to act, including offering her services as a lawyer pro bono for a lawsuit to challenge the state in its failure to meet the obligations to meet the needs of frail elders by delaying the approval of their access to the Medicaid program or by outright denying them access to the Medicaid program. things for which they in fact were eligible. The state's failing was leaving frail elders in harm's way. They were left at home without the services and supports that they deserved to have, or they were denied access to nursing care facilities where they could get the services and supports that they desperately needed. The actions of Molly and 4 other pro bono attorneys garnered the attention of the Federal Oversight Agency, CMS, and it galvanized CMS to act. And the way that they act was by beginning to monitor the changes that Kansas was making in its Medicaid program and requiring the state to report to them biweekly on the actions that they were taking, on the applications that they were approving or that they were delayed in approving, and by generally forcing the state to do what it is contracted to do under the Medicaid program for vulnerable Kansans. Ultimately, it resulted in the state committing additional staff and resources to eliminate the backlog of Medicaid applications and once again open the doors to the needed services for hundreds of thousands of Kansas Medicaid applicants. That's no small feat. And Molly is known for her willingness to take on those kind of challenges, to share the expertise that she has. She has a lion's heart, and it's been an honor and a privilege to work alongside of her and to nominate her for this award. And I'm so pleased that you agree with me that she is certainly deserving of it. So thank you. And congratulations, Molly.
Oh dear. Golly. I'm overcome. I'm purring rather than roaring. And I have to comment that the big lie to which I was referring has been completely outclassed by a much bigger lie. So I'm glad I got to use the big lie before it was subsumed. I have prepared some remarks because I've moved on from Medicaid, although that is my main area of practice, is Medicaid, which is a welfare program, Medicaid eligibility for nursing home care. But in this season of Medicare enrollment, I just think that I want to talk about Medicare just a little bit. I won't lecture to you. Jim gave me a strict time limit, and but I'm guessing you all understand more thoroughly than I what was fundamentally meant by open and accessible government. When I think about it, to the extent I understand the concept, I wish we had it. But I must say, I'm beginning to wonder whether we collectively have the vigilance and the will to pursue a more open and accessible government, because it's exhausting, right? The activities to which Mitzi referred went on for several years. And you all know that is the course of progress is very slow, but Medicare is one of those really bright spots in government policy. It was born about halfway between through the League of Women Voters history. it's a good example of a profoundly successful government function. But it continues to require our constant vigilance. We can't just sort of say, okay, we've got that one taken care of, or we'll backslide. And that's what's happening. I wanted to talk about Medicare because it's just relevant to everybody. Either you, like me, are a Medicare beneficiary, you have family members, you sat by the computer with your mother while she put in her prescriptions for her prescription drugs, or when the first prescription drug plans came through in 2005, I sat with my mother and all of her neighbors at the computer to help them, because in 2005, they started a prescription drug program that was accessible through the internet, rather than accessible the way, 15 years ago, elderly people accessed services. In Kansas, there's 60 million, there are over 60 million Medicare beneficiaries. So it's ubiquitous. And all of those people are either by definition 65 or disabled. So in Kansas, over 500,000. It was 541,000 when I looked it up. If you're over 65 or disabled, you are quote unquote undesirable, because you're expected to have high needs. And that was what's so great about Medicare is that it's access to health insurance to folks for whom access to health insurance would be difficult. Elderly, expected to have high needs; disabled, of course, expected to have high needs. And the principle of insurance over those huge numbers works so well. Everybody's in the pool, and there's a lot of expense related to the healthcare needs of everybody in the pool, but it's spread over such large numbers that everybody kicks in. It's just like, your homeowner's insurance. Your homeowner's insurance is a small if you own a home, or rentals insurance is a small fraction of the value of your home. My house isn't going to burn down, but if it did, it would be a catastrophe. If my house doesn't burn down and the money that I pay into the insurance company helps somebody else's whose house burnt down, who had that catastrophe, oh, well, that's great. I helped, and my house didn't burn down. So, people forget about the principle of insurance, of spreading the risk of a horrible catastrophe over huge numbers of people. Okay, but powerful entities always are trying to extract money from the government. I could give you 1,000 examples, and those entities are able to influence policymakers behind the scene. And because of that, we've seen a serious erosion of Medicare. You do not see any politicians of any stripe saying Medicare is socialism, therefore it's bad, and we want to do away with it. No, it's the death by 1,000 cuts, and it's erosion. And a good example is the Medicare prescription drug coverage. In the first place, it's wildly complex, so it makes it hard to be a very smart consumer. And the plans and the plans get paid by your premiums and by Medicare to pay private insurance companies to and private companies are designed to make profits. I mean, I work for a law firm. We're in the business of making money. I'm not saying that that's a bad thing. I'm just saying that for us to be paying Medicare taxes and premiums so that prescription drug companies can make more money, that doesn't make sense. And the more money that they can charge, the more money they make, which is why, if you read my last column in Douglas County Senior Services, which is why policymakers who are improperly influenced, not open and accessible, but rather influenced behind the scenes, to not want Medicare to be able to negotiate with drug companies on medicines. So I looked this up at the Kaiser Family Foundation. 88% of citizens think that Medicare should be able to participate in negotiations with drug companies. 88% of Americans don't agree on anything. 88. I thought, well, maybe it's in the 60s. 88% think that, oh, we should use our superior bargaining position to get access to superior pricing. And so why is it that there's not a hue and cry at every member of Congress, every state official to be in favor of Medicare? I mean, this is the epitome of inaccessible, non-open government. Although I bet you could come up with 10 other examples. And don't be telling me that we won't get good medicines because the Veterans Administration has been negotiating on prices for decades, and somehow drug companies are still selling to them. So you've seen the ads. Don't let any of your friends buy this. We won't get good medicines, or the government is going to control your health care. That's all I'm going to say as far as being on my soapbox. But combating misinformation, it requires so much effort. You have to understand how the system works. You have to understand the motivation of the people who would mislead. These ads, if you look at the bottom of it, you have to stop your TV so you can say, who's saying this? Pharma, the lobbying group for pharmaceutical companies. And overcoming the misinformation with accurate information, it's just exhausting. 100 years ago, the League of Women Voters addressed the fact that half the nation's citizens had no real political power. It took a while. And there's still some work to do. This award gives me a boost, though. And it reminds me that sometimes the fruits of our labor are enjoyed by future generations. Thank you.
Thank you, Molly. Thank you both. Does anybody want to have some more questions or discussions now? Anyone have anything they would like to ask Molly, perhaps? I guess.
Oh, come on. It's free.
I would ask something. The legality of those Medicare Advantage plans that, of course, just flood the airways right now. They make it sound like this is traditional Medicare, but you're just missing out benefits because you don't have our Medicare Advantage company. You haven't chosen us. Isn't that blatantly deceptive advertising? I'm sure they skirt just
Well-
on the outside of it, but
I mean, two answers. One is that this is permitted by federal law, and you all know how laws are made. So this is permitted by federal law. And also it is set up to undercut, to erode the solvency of original Medicare. Because, you know, I just rant and rave about the Medicare Advantage plans. Until I turned 65, I had no idea that I would be inundated with, I mean, in the mail, on the phone, email. I'm not on Facebook, so I'm not getting them on Facebook. But these companies make money by creaming the young, well elderly off of the top and touting these benefits. And then as soon as you get sick, you want to go to original Medicare because original Medicare is better. So it's absolutely permitted, and it's permitted by policymakers who fundamentally disagree that we should all be in this together, because it undercuts the basic mechanism of insurance that we have, that everybody's in the pool. And if everybody's in the pool, everybody pays a little bit. And if you're real sick, you get covered. And if you don't get covered, don't get sick, okay, I can live. I would rather not get sick. So every time we make it possible for anybody, particularly a profit-making entity, to cherry pick and get the well elderly out of the pool and paying premiums to another entity, we undercut the principle of insurance. That's not socialism. That's just the principle of insurance. If that's socialism, then, you know, in the requiring your car to be insured is the state of Kansas requiring you to participate in a socialist enterprise. So I don't think that is correct. But thanks for asking, because obviously I feel strongly about it.
and Seal is wondering, I didn't know if you had your chat opened up or not, but Seal is wondering, Molly, could you write a piece on the facts of Medicare versus Medicare Advantage? Or have you written such a piece?
Oh gosh, you need to get tuned into the Douglas County Senior Center, Senior Services newsletter. I have written a column for that newsletter every month since 1995. So
there will be something in there
look
about
in the
that.
archives. The most recent article I wrote was about prescription drug, about these misleading ads, because I was at home for lunch one day and watching the Food Channel, and here's one of these ads come on. And I thought, no, that's not right. So, but I've written about Medicare Advantage plans a number of times. And if you go to Douglas County Senior Services and talk to them through their SHIC counselors, I mean, everybody in Douglas County could go to talk to a senior health insurance counseling for Kansas, SHIC counselor. Could, you know, every year you could review your Part D and your Medicare supplemental insurance. Well, I have Medicare supplement. I'm not participating in that darn Medicare Advantage stuff.
Any Anybody have any other comments or questions? Yeah, Marcy was wondering if we could, here, let me go get back to the chat. If we could have permission to reprint your columns.
Sure, sure, yes, absolutely.
Good.
Anytime, anytime.
I put in the link in the chat to the Senior Resource Center there.
Good.
Do.
Click that and that'll pop up on your browser and go to their archive newsletters.
Holly, I know you're talking about Medicare, but I want to ask you a question about the Medicaid program as it relates to older adults in the state of Kansas, especially as it relates to home and community-based services. How well is that program serving older adults? And what are the things we need to be addressing in the home and community-based services, given the fact that so many people have been harmed in nursing homes over the years, but certainly isolated and harmed through what's happened with COVID? So I know a great alternative is home and community-based services, but how accessible are those? How available are those? And what would you say about public policy to improve that?
Oh, Mitzi. I trying to think of how to answer a great question with an answer that doesn't keep you all from your lunches. The Home and Community-Based Services is a Medicaid program that says, oh, you're so impaired, your impairments are so severe that you meet a nursing home level of care, but you could stay at home. Mitzi knows I took care of my dad at home for the last 3 years of his life. He definitely met a nursing home level of care. He's extremely frail and moderately demented, but he was not on Medicaid because he had the ability to pay for in-home care. So I took care of him when I wasn't at work, but then I had people come in and take care of him. So he didn't have to go to a nursing home. And as long as we could cobble together enough in-home care and with me here at home, we could keep him at home. He didn't have to go to a nursing home, which I really didn't want to do because I don't think people get very good care in nursing homes, generally speaking. I mean, Mitzi and I could write a couple books about that. But anyway, Home and Community-Based Services says, oh, well, if you stay at home, we will fund, since I don't know, I think at the peak of just before my father's death, probably $3,000 a month worth of in-home care, which exceeds many people's income. But the state of Kansas would subsidize that for a low-income person. And it sounds great. There was a long period of time to which Mitzi was referring, where you couldn't get a Medicaid application processed timely, and that how long, if you meet a nursing home level of care and you can't afford to pay for in-home care privately out of your pocket, which is the definition of Medicaid eligibility, people were ending up in nursing homes because they couldn't get access because the state of Kansas wasn't processing the application. We don't have forever to wait. And so the processing times are much improved. And because of all the fussing that we did for several years, and we have a different administration that is, frankly, just more, it's not benign, but it's more responsive. What we've got is a separate unit that helps process those applications. So the application processing isn't the problem. What the problem is, that is a problem for nursing homes and the problem for people who, like me, when my father was living with me, finding people to provide high quality care. Medicaid pays an amount that nobody would work for. I would rather flip burgers in terms of the hours and the working conditions and the benefits. And so the problem is, and nursing homes have this, and it's one of the reasons that nursing homes don't provide very high quality care, because they don't pay good wages. And it's a really hard job. So I think the bottleneck is not, will you become Medicaid eligible? You can become Medicaid eligible and get the processing done and get the analysis of how much assistance you're going to get and what the cost will be. The problem is finding someone who will work, or the state having access to people who would work for the wages that Medicaid or nursing homes will pay. So we're going to come a cropper on this idea that we've got all these people who need high levels of care. People with dementia need very high levels of supervision, if not care. The real problem is we've got to staff nursing homes, and to staff nursing homes and in-home care services, we have to pay much higher wages and train, offer training and support networks for people who are who do this very difficult, important job. I don't think I had the answer to your question, Mitzi, but I do, that is the issue that I see, is that people who meet a nursing home level of care, or who could stay in their home if they could get care. The point is, who's going to do it? Who's going to show up? Who's going to be reliable? Who's going to, I had people in my home taking care of my dad they were so great, I wanted to adopt them. And I had people in my home taking care of my dad who I told them that I wanted him to leave and not come back. I came this close to putting in a granny cam in my home because I wanted to hear the tone of voice that was being used in my absence to talk to my dad. So, and granny cam, that's another whole issue. So anyway, home and community-based services are not the panacea until it's funded to the extent that people can hire high quality workers to come take care of them.
Norma had a question asking if anything with Advantage in it. She has Blue Cross Advantage through state of Virginia retirement plan. Is that the same as a Medicare Advantage plan advertised on daytime geezer TV? She asked.
Don't know.
Yeah, I don't either, but I think
I suspect, since it has Advantage in its name, that it is an Advantage plan.
I think so. And wasn't Advantage a compromise when George W. Bush was trying to get rid of Medicare? Wasn't this the compromise they came up with to have these Advantage plans? Or am I mistaken about that?
Well, I don't have a clear sense of what the legislative history is, except that it would not have been possible to get rid of Medicare. There would have been people in walkers storming the Capitol. So it was a what's it called in battle when somebody comes from the side? A lateral, that's not the right term, but it was a sneak attack where people will say, oh, well, you'll get all these extra benefits and it'll be low cost. And whereas like nobody was saying we want more private insurance companies in the Medicare marketplace. Nobody was saying that in 2000. The idea that that it was a compromise, I don't think that it was helpful to get private companies involved in Medicare Advantage and in sending the money that was supposed to go for original Medicare to private companies. I feel completely differently about Medicare supplemental policies. Medicare supplemental policies are set up so consumers can understand them, and they all have to have all of the basic coverages in them. And it's an apples and apples comparison. If you look at the Prudential plan and the Blue Cross Blue Shield plan, F, they are the same. They represent the same things. So it's not such a nightmare to try to sort through what you're purchasing. And they seem to be I have a Blue Cross Blue Shield supplemental policy.
Mitzi has corrected my misconception. I attributed it to the wrong president. She says Bill Clinton signed it in 2003.
Bill
The
Clinton
Medicare
wasn't
Advantage
president in
legislation.
2003.
Blame the internet. I Googled it.
Oh,
But Bill Clinton
Clinton
was out of
wasn't
office
president
by
in
2001.
2003.
Okay, I'll
He
Google
was
again.
president 2003.
So I'm pretty, for the Medicare Modernization Act was 2005. But that's prescription drug. Medicare Advantage was a little earlier, but I'm pretty sure it was the Bush administration. I wouldn't bet the farm on it, but I'm pretty sure it's, and I am sure that Bill Clinton wasn't president in 2003. Because remember the 2000 election was the Al Gore.
Okay, here's what it says. He
Okay.
signed it into law in 1997, but it was signed in as Medicare Plus Choice. And then Medicare Advantage changed, the name changed in 2003.
Right.
Sorry about
I believe that. 97. Okay.
there you go. You heard it here. Now we have the straight facts.
Okay. Anything else anybody wants to bring up? Okay, well,
Well, thank you so much for allowing me to climb on my soapbox. I'm flattered. I'm honored. And I've enjoyed my little talk.
I think we all did too. You gave us a lot to think about, so I appreciate it. And I guess that's the end of our presentation and our meeting. Thank you all for coming, and let's hope next year we'll all be in person and get to chat. And Molly, you will hopefully come back and we'll be able to talk to you too.
I'm looking forward to it.
Thank you.
Thank you, everyone.
Bye.
Thank you, Molly. Thank you, Mitzi. Thanks,
Thank
Jim.
you so much.